Assalamualaikum warahmatullahi wabarakatuh, and good morning to all. Hopefully everybody is in a good condition. So I'm Associate Professor Dr. Rustiani Muhammad. We'll talk about successful consultation. As we all know, SC or successful consultation is a meaningful consultation. Means this is a two-way dialogue rather than one-way dissemination of information, meaning we talk to the patient and it should be interactive. Okay, you can do it alone, just talk to your patient and shut your patient down. No, it is a process rather than standalone events, and it involves patient and we as a healthcare providers. Okay, before we go further, these are the outlines of our lecture today. So where I will make sure that all of you will know the objectives of this lecture. And please make sure that you understand all the objectives. And after that, we will talk about some introduction, the purpose, stages of consultation, features of good consultation, and lastly, what will be the pitfall. So these are among the objectives, which is we want you at the end of the lecture able to know the good consultation features, able to apply in your practice later on, and able to avoid any pitfalls in the consultation with your patients. So medical consultation is about you take the history, you do physical examination, and overall management of the patient. So you talk to the patient, what is the diagnosis or what are the probable diagnoses, and at the same time you will discuss about the appropriate investigation, to come out to the professional one, and then how to manage this patient, either non-pharmacological or pharmacological aspect. So it involves two ways communication, meaning face-to-face communication. But during pandemic, it has dramatically affect our lives. Also healthcare system and also economical thingy of our communities. And yes, of course, we are also affected. The healthcare system also affected significantly. So the way we communicate might be slightly different because we start to use ITs. We start to communicate online. We start to communicate via phone, via internet, something like that. So we also have to know how to hold virtual consultation. It seems like the same, but sometimes you have some difficulties when you start to conduct it via online. Okay, next is about contribution to diagnosis. So when we talk to the patient, we communicate with them. So it's not about what we know best to the patient. We know best what is best for you. So that's the main thing. It's not a doctor-centered thing. It's about patient-centered, meaning we need to have more involvement from patient side. Because of that, the history should be really focused and try to find out among all the history. Usually you have a list of thingy that you want to ask the patient, but during this consultation you have to focus. Once you heard about patient main concern or main problems, the chief complaint, then you have to stick in your mind what are the possible important history that you need to take. So you have to focus within limited time, especially we are in the primary care. You don't have enough time to do everything like you have done in the ward because you have longer time with the patient, but now you have to train yourself to focus your history taking. Okay, after that you followed by appropriate physical examination. We can see that we don't actually examine everything, yeah, in the clinic. You just focus if the patient complain of something related with yeah, headache, something like that, and have some weaknesses, yeah, feeling unwell, then you might think of neurological examination, or you might try to find out is there any problem in the eye or balancing. So these are among the things that you start to focus on, only this, but you're not doing everything under the sun. And after that, you will think what are the appropriate investigations to do, okay, to for this patient. So apart from to come up with the correct diagnosis, consultations are important for us to make mutual decision on the patient's management. Okay, after you got everything, you talk to the patient, okay, from physical from what history taking, physical examination, and also investigation that we were able to do today. So these are among the possible diagnoses, and what are yeah, the main management you would like to offer the patient. Okay, and what uh, uh and the consultation are also important for us to make mutual decision. Meaning, if, for example,
The time is 9 o'clock a.m.
okay, we have how many types of antihypertensive? Four types of antihypertensive, for example, or five types of antihypertensive drugs available in our clinic. For example, among these, what are their mode of action? How it works? So you discuss with the patient, oh, this one is suitable for this one suitable for this. So among all, I think this is the most good thing, the better suits you best, for example, something like that, so that the patient start thinking, oh, okay, I'll agree with this, or I like to have this because my mom are also on, for example, amlodipine, but you think this patient might better with ACE inhibitor, something like that. So you try to negotiate among the among both of you, and because you try to solve the problem, something like that. Even for non-pharmacological, for example, um, you want to prescribe nutrition therapy to the patient, yeah, medical nutritionist therapy, or nutrition therapy, something like that, or exercise thingy. So you have to understand from the history. Okay, you have to go the at least one day full day history of diet or physical activity, or if good you can take it 1 week history, so that you understand how the patient's life. Okay, so when you understand that, okay, you can offer certain things. How about doing this? Patient said, oh doctor, I can't do this, blah 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 blah, can I do this way? So you try to negotiate and find out which one fits. Okay, and you try to step up. For example, the patient, yeah, you talk about brisk walk. Yeah, it's really good, for example. But yeah, but the patient don't like to walk. Yeah, she said, oh, I have no time to walk, I just walk in the house doing house chores, something like that. And what you need to do is, okay, you try to clarify what type of house chores, how long the patient will do it, usually do it, and then what else? Yeah, because you want to know the intensity and duration of it, and then you start to modify it and ask either patient able to do it, and you staggeredly, yeah, increase the intensity, and duration. So with the some discussion and mutual agreement with the patient, something like that. Okay. So other than that is to provide advices, yeah, the purpose of consultation to improve knowledge, okay, about the disease, the medication, the compliance, the complication, the risk, the modifying risk factors that we can discuss with, and to create trust so that our doctor patient relationship will maintain excellent throughout the treatment process, and to reassure once needed, and so on. So we can see so many a purpose, yeah, the aim of doing consultation. After that is about preparation. We need to prepare, okay, especially when we still not in initial phase, we are not so well versed with the consultation. Sometimes we not sure how to ask the patient, something like that. So you have to prepare physically and mentally. Okay, so also cognition or cognitively. So you have to appear confident, yeah, confident with your knowledge, confident with your communication skill, yeah, confident with how to encourage and motivate patient, because it's about behavior is something so difficult for us to modify, but yes, you have you need to have some skill. And then mentally emotionally prepared, yeah, you can let yourself anxious throughout consultation. No, you have really calm and think one by one, but you have to think fast. Okay, focus firmly on the patient concern, idea, and expectation, and please not be in a hurry. Yeah, so please relax. Okay, because once you relax, yeah, you're able to think wisely. Okay, so this is how you should look to the patient. I will smile, and because the smile itself can heal the patient with your words, with your behavior, also can heal half of patient's problem. Okay, apart from that, for patients, yes, because sometimes patient put a hospital or clinic is the last choice for them to come and get the management or treatment, so that they usually go to other places first, for example, yeah, other type of therapies, TCM, something like that. So yeah, everyone need to prepare, yeah, so that you can come up with a good rapport and better and successful consultation at the end. So apart from that, we also have to prepare our settings, yeah, how we can we engage meaningful meeting face to face, yeah. So this is the among the thing that we have to think, especially if we are working in yeah, private sector, even in our own clinic, you can go and find out, is it our table, chairs, setting, everything is good, yeah. You have to also put the priority of your safety, so you know where the doors, uh, is it easy for you to move out if anything happen, yeah. So that's the thing that we have to cater. So among the setting, so the first one is the privacy. So please do not share with other doctors or make two consultations in one room, yeah. And then make sure the table, the seating and arrangement is also good. There are a few types of arrangement we can see, and how should we in the health center have. And then we need to know the distance, the safest distance, yeah. the distance that make everybody comfortable, and also the lighting and temperature. So now we can see this is about one of the setting. Yeah, we can see face to face is really direct between a doctor and also the patient. Is it good if you use this way? What do you what do you feel? Okay, you can see. Is there any what we call either this arrangement is good for you? What do you think? Huh? We can see that this arrangement is not what we done in our clinic, and why. Okay, please find why we not choose this arrangement. Okay, why we sit in the corner. Yeah, we're not directly seeing patient. We might think, oh, this is a good one because we have good eye contact. Why are we not doing so? Yeah. So these are among the seating arrangement that we have. So where should be the patient's chair? So if C is too close, yeah, this one you might feel some distraction because there is something in between you and the patient. The patient also feel not comfortable. But if we choose this one, we actually much more um, have what uh, feel better layout, yeah, in terms of the distance and the way we can communicate, and all of us will feel comfortable. So these are among the distance that we need to follow, yeah. So because we need our own space, not too close or not too far. So 4 to 9 feet actually is good enough. It's just nice for us to be with the patient. Okay, so what should we do before the consultation? So in the clinic, yeah, the patient have their own notes, or yeah, so that please go and read the notes first. Okay, just flip through. Quickly flip through and have some ideas about the patient. Because of that, why we keep the notes, yeah, either manually, yeah, in the file, or now we have electronic medical record, yeah, in the internet. Everything you have just go through so that you find out, oh, what is the purpose for this consultation, or if last communication the patient have some investigation, so you can have you have time to check and find the result, for example. And yeah, so these are among the things that you have to prepare, especially yes, for chronic diseases patient. Yeah, so that we know the previous plan and the continuation of care. Even though for our clinic, for example, we can see we have different doctors, yeah, we try to make one patient for one doctor, yeah, we have a family doctor, but sometimes it's so difficult, especially yeah, um, the turnover of the MOs, yeah, the master students in our setting, causing sometimes the continuity of care to one patient to one doctor is so difficult. So what we need actually is a good documentation. So what should the next doctor do or follow, or yeah, something like that, so we have some communication in the patient's record. Okay, so we have some ideas at the end. Okay, before we start our consultation, either it has been settled or not, or what were the previous plan that need to be done in this visit. Okay, so during the consultation, so As usual, please ask the patient's social background, greet the patient, build rapport, put the patient at ease because when our rapport is lacking, they start not to disclose certain things to you, yeah, especially something that really sensitive. So please build the rapport first, okay, and then have a good eye to eye contact, and please listen, okay. Listen mean you use all your sense, yeah, your ears, your eyes, your cognition, yeah, your cognitive, your thoughts, yeah, to think about. So please do not write everything, single thing. Just like you take the history, you start to write, scratch everything on yeah, as a notes. Please not do that. Yeah, please remember because this is the story. Because of that, you take the history should follow the time frame, so you can put the time frame. So what happened here when it was diagnosed, what happened during diagnosis, what have been done, what have been investigated, and what was the management during that time and throughout the time. So what happened? How about the control? How about the complication? How about the symptoms? Blah blah blah. And then you go through. When you have a good timeline, you don't need to write everything. You can remember, yeah, the patient's problem very well. So because of that, please make sure you not write so many things. Yeah, start writing, because you will lose your concentration to the patient's history. Okay, patients should be given the chance to express, not you the one who talk. It's like you interview somebody. It's not you telling things. No. Now we want to hear history from the patient. So you use the open-ended question. Please remember that. So yes, remember, jot down only the important things, follow the timeline, and then you need to understand the sequence of the problem. Why this happened? Why do you think this occurred? Do you have any idea on this? Sometimes the patient knows what is the cause. Okay, what have you done? Okay, so that you know better about the patient feel comfortable with you and will start to disclose everything to you. Okay, now we go to, yeah, during the consultation, it's about listening, yeah. This is a technique. When we talk about listen, it's not about only ears. You have to use so many other things, meaning how you ask the patient using open-ended question. Please, we will know either you use open or close-ended when you start to talk, when you deliver your case, yeah, you present the case, then we know, oh, so means you do it so many close-ended things, yeah. So please facilitate them to respond, yeah. Oh, okay, can you tell more? Okay, why this happened? Please go on. So you facilitate the patient to talk and patient feel appreciated, okay, and show your interest in what the patient is saying. And please leave the direct questioning or close-ended question to the end. Okay, so why the is important for us to listen is because the cues. Sometimes patient not talking, but they give the cues either in their speech, the way when we talk to her, they give some hint, or sometimes the way the facial expression, for example, the way how patients behave. Sometimes they give cues to us, and cues are often missed because doctor isn't listening. So among the tips, yeah, I think every one of us already know the tips, but you have to do it. Okay, you have to do it properly, then you can get it. So please make eye contact again, adjust your body posture facing the patients. Okay, please lean forward rather than you lean backwards, something like bossy, something like that, and give verbal and non-verbal acknowledgement. Yeah, so please clear your mind, clear your thought. Please let go your assumption. Sometimes you start to uh, presume something. You assume so much about patient. You have a prejudgmental about the patient. Yeah, please put it out from your mind. Just focus to what the patient want to tell you. So other than that, please avoid distractions. Something like phone call, just switch off or slow down the volume, something like that. So please minimize the distraction. So can we make it? Yes, of course we can make it. It's about practice. Okay. So other than that, it's about our eyes. Look out for the important leads. Yeah, verbal and non-verbal, and follow them up. This is particularly important when exploring the patient's understanding of his problem and its impact on his life. Because of that, we have to understand. So, what patient understand with their own disease, with their own medication, and what they should do for non-pharmacological advices. Why patient adhere and why patient do not adhere for certain things. So that listen to patient and we will find out the answer. And then please use the language that easier for patient to understand. Please avoid medical jargons. Yeah, if you don't know the appropriate word, then explain about things. So non-verbal explanation is about gesture, our body movement, uh, uh, how we use the space, how we tune up or down our voices, and also the way we choose the clothes. Yeah, like we can see in the psychiatric cases. Yeah, this thing is really important. How they dress, how they put makeup, and so on, and how they walk into our room. So apart from that, what we need to do is encourage the patient to tell his story in his own words by facilitation. As we mentioned before, please go on, tell me more. What happened then? You said you felt pain, so how is it now? And for non-verbal, we start nodding our head. Okay, and then we start to posture our body, which looks to the patient that we really interested in their story. Apart from that, giving the patient sufficient time to talk and avoiding coming in too quickly. Please do not cut what the patient said unless something is not is not the focus, and you try to cut it really nicely. And if you need more time and you don't have enough time during that consultation, you start to talk to the patient. Okay, okay, we will discuss this in the next follow-up. You try to settle this part first. Okay, I'll find this is among your problem list. Yeah, the things that you want to talk to me is A, B, C, and D. So we will cover this part first because the D thing is really long. We need more time. Maybe we need to do it in the morning or afternoon, wherever it suits best for both of you. And then we will talk further on this. For example, okay, you can give another time to the patient. And please do not too quickly ask the question or give the reassurance. So other than that, help the patient to describe the real nature of any problem by encouraging them to provide actual example of the problems and their effect. For example, you say you are having panic attacks. Can you describe a typical one? Can you describe the thing that you always have? Yeah, that you remember most, something like that. And then paying attention to verbal leads. For example, I've had this terrible pain. I've not been sleeping very well. I've been so miserable. So non-verbal thingy like patient looks in agony or looks upset. So you have to um, listen and watch everything that occur in front of your eyes, something like that. And all of this has their own meaning. Okay. As mentioned earlier, avoid the use of jargon. So other than that, you have to bring back, yeah, especially when patient talk too much and talk something out of the main focus or main history. So for example, how we talk to the patient, that's interesting. But could we return to talking about your headache? So you focus, go back and talk about that. Okay. So how to clarify? Yes, after some time, yeah, you give time to the patient and you start to clarify. What will help me if you could focus on this? Yeah, because we want to find out the diagnosis. So once we get the diagnosis, or a possible or probable diagnosis, so easier for us to manage or to do next step, which is physical examination and also investigation to find the diagnosis. Okay, after that, what else? Please avoid confusion in the history by asking the patient to be precise about date. Because of that, I'm talking about the timeline. So when this occur and what happened next and what happened in 1 month, 3 months, and up to now. So please precise on that. Okay. So the events, the nature, and the previous treatment and management. So we also have to clarify any uncertainties that arise during the interview. For example, I'm not very clear when you trouble started. What could we try and get that clear? And other than that, you can cross check your point uh, with the patient, or you say like, is it this is what you mean, for example, or please say again about this because I can't get it, for example, something like that. Apart from that, we have to review, yeah, when we get a very long list, yeah, the history, which the patient like to tell the history. Okay, so allows review is able to allows correction of any misunderstanding between both of you, so enable you to bring the patient back to the point. So the important is to bring the patient back uh, to understand the patient's meaning, and you may wish to explore in greater detail. So this is the do and do's during the consultation. For example, any problem, this is something that, yeah, we like to do, yeah. Any problem, something like that. You have to use other words. How can I help you? Okay, why do you come today is really straightforward, and something like you saying like you do not really interested in their problem. Other than that, please do not say like this. Your headache, is it over both side, or your head is about close-ended question? Yeah. So all of this is about close-ended questions. So what we need to do is about open-ended question. Can you tell me more? Anything else? How was your mood? How about your breathing? And please use how and why. Yeah. Why? What happened like that? Can you tell me more? Something like that. It's not just why and just stop. No. Okay, so these are among the thing is about about listening, something that we have already discussed. Because listen with eyes and also sense of touch, feeling and emotion, something that we need to put it together, mind, heart and imagination. Okay, listen to the words of others, message that are buried in the words and encoded in all the cues. So we listen to the voice, the vocab, the gesture, and we listen to the context, verbal message, linguistic pattern, and also bodily movement. Because of that, we have to understand the local language. Yeah, the mother tongue of where you are. Now you are in in Kelantan, so that you have to understand the Kelantanese dialect because the word sound sometimes similar, but the meaning is different. So you have to understand that. Okay, how to end the consultation is among the most important part. You have to know how to end it. If not, the consultation will go on, and you don't know what to do. No, please know your limitation. So inquire if there is anything he would like to add. So at the end, you summarize thing and ask, is there anything else that the patient would like to share with you? Okay, so the main thing you can find out the ideal concern and expectation. So and then you explain what you understand and what do you think about the diagnosis, and then what you need to do next, meaning physical examination, and later on after doing some investigation you can discuss about the management. Okay, so among the common pitfall, okay, when interviewing patients is the first one for sure, poor eye contact. Yeah, because you are too shy or you don't want, you have something else. Yeah, before go to work, please, if you have problems in the house with your colleagues before that, with your boss before that, please put it outside your mind. Okay, just focus to your patient. Okay, over reliance on notes, yeah, just read the notes, something like that, just writing so much, or reliance on the systematic inquiry because you have the long list what to ask and you start to follow one by one. You try to remember, oh, after this what to ask next, what to ask next, and you start to remember new morning. Now, please, you are now in year 4. You have to know by heart, and you have to know your own. You have to come up with your own skill how to make it appropriate. Yeah, or prematurely focusing down on the perceived problem, and or you have lack of clarification, failure to follow up patient's cues, or something deficiency in the questioning style. Because of that you have to practice how to ask the patient, then you don't have problem when talking to the patient. Just talk to yourself, talk in front of the mirror, what else, what to ask, what the words that should you use every day. So you start practicing that. Okay, omitting to ask what the patient's idea about their problems. Yeah, yep, you just omit. Please do not omit. Sometimes patient really know the cause, but you have to ask. But patient usually don't want to tell you unless you ask them. Okay. So some other difficulties, and you try to diffuse patient anger before starting. Yeah, yeah. You start to talk something that make the patient feel uncomfortable. Please do not do it. Or those accompanying the patient should never be ignored. Yeah, please also address the patient's relative or carers. Yeah, So sometimes you can also ask the patient, the relatives to help. So this is the thing, the illness. You have to understand the illness. It's about disease, it's about the illness. The illness means the patient and the environment surrounding him. So among the environment factors are patient's relative or carers that you have to um, also take into consideration while managing the patient. So what we need to do is to always be professional. There is more to being a doctor than just acquiring a medical degree. Yes, you have learned so many things about social life. Whether we like it or not, we are exemplar and opinion leaders in our community, because for patients usually they put our statuses higher up. So please behave accordingly, talk nicely, appropriately. So good manners cost nothing and make life a lot pleasant. And ethical standards in medicine, you have already heard about ethical thingy, so please learn about it and practice it in your life. If not, if you not follow the ethics, the oath, you not follow the law in your practice, it might cause you trouble later on. Please, please, please do not make your name and also your institution, where you come from, yeah, you grad from where, yeah, causing other people feel down on you. So please make sure be professional and always follow the ethics thing. Yeah, either the medical oath also, and also for Muslim oath as well. Okay, I think that's all you have heard about ethic thingy, and now we have summarized in terms of other important thing to come up with the good or successful consultation. Thank you for your attention. Okay, bye. Assalamualaikum warahmatullahi wabarakatuh.